The sound of the rotor blades didn't just shake the windows of Mercy General Hospital. It shook the very foundation of the hierarchy inside. For months they called her the Ghost. They laughed at her silence. They mocked her trembling hands when Dr. Sterling screamed at her. They thought Maya Vance was nothing more than a washed-up, incompetent diversity hire who couldn't handle the pressure of a civilian ER. They were wrong. Dead wrong. When that Black Hawk touched down on the helipad and a squad of Navy SEALs stormed the ER with weapons drawn, they didn't ask for the chief of surgery. They didn't ask for the director. They screamed one name, Vance, we need Vance. And the woman who stood up wasn't the quiet nurse they bullied. She was their only hope. The fluorescent lights of Mercy General's emergency room hummed with a headache-inducing flicker, a fitting soundtrack for Maya Vance's life over the last 6 months. She stood near the nurse's station, her posture slightly hunched, eyes fixed on the charting tablet in her hand. "Hey, Mouse," a voice sneered from behind her. Maya didn't flinch. She didn't turn. She just tightened her grip on the stylus. It was Jessica, the senior charge nurse, who had decided on day 1 that Maya was prey. "I'm talking to you, Vance," Jessica said, stepping into Maya's peripheral vision. She was holding a tray of half-eaten bagels. "Dr. Sterling needs his coffee. Black. 2 sugars. And try not to shake so much when you hand it to him this time. It's embarrassing to watch." "I have rounds to finish, Jessica," Maya said softly. Her voice was raspy, low, unused. "And Dr. Sterling has a god complex to feed," Jessica shot back, dropping the tray onto the counter with a loud clatter that made a passing orderly jump. "Go! Now!" Maya exhaled a long, slow breath through her nose. Control, she told herself. Just breathe. You aren't there anymore. You're here. You're safe. She walked to the break room, her orthopedic shoes squeaking on the linoleum. As she passed the trauma bay, she heard the distinct, arrogant baritone of Dr. Marcus Sterling. He was the chief resident, a man whose ego occupied more square footage than the hospital itself. He was currently berating a first-year intern for stitching a laceration too slowly. "You're treating a patient, not knitting a sweater for your grandmother," Sterling snapped. "Get out of the way." Maya kept her head down, pouring the coffee. She hated him. Not because he was mean. She had dealt with mean before. She hated him because he was dangerous. He was reckless with patients, relying on his family's connections to sweep mistakes under the rug. When she returned to the station, Sterling was there, leaning against the counter, flirting with Jessica. "Ah, the mute returns," Sterling said, not looking at Maya as he took the cup from her hand. He took a sip and immediately spat it back into the cup. "Cold, just like your personality, Vance." Jessica giggled a sharp, cruel sound. "I told her to hurry, Doctor. She moves like she's underwater." "It's fresh from the pot, Doctor," Maya said, her eyes fixed on his tie. It was crooked. It bothered her. Sterling stepped into her personal space. He was tall, athletic, the kind of man used to intimidating people with his physical presence. "Do not talk back to me. You are a nurse, a barely competent one at that. You are here to facilitate my brilliance, not to offer commentary on the temperature of fluids. If I wanted back talk, I'd call my ex-wife." "Yes, Doctor," Maya whispered. "Speak up," he barked, slamming his hand on the counter. Maya flinched. It was a micro-movement, barely a twitch of her shoulder, but Sterling saw it. He smirked. "Look at that," he said to the room at large. Several other nurses and interns looked over. "She's shaking, terrified. Tell me, Vance, did you actually go to nursing school, or did you buy your degree online?" You act like you've never seen a drop of blood in your life. I'm just doing my job, Maya said, turning to leave. You're a liability, Sterling called after her. And as soon as my tenure as chief is confirmed next month, you're gone. Mark my words. Go clean bed 3. Someone threw up. Maya walked away, her face burning. She could feel their eyes on her back. She could hear the whispers. She's so weird. I heard she was fired from her last job for panic attacks. Why does she wear those long sleeves under her scrubs? It's like 80 degrees in here. Maya pushed through the curtain of bed 3. The patient, an elderly man named Mr. Henderson, was asleep. There was no vomit. It was just a lie to get her to scrub the floors. She grabbed the mop anyway. As she worked the rhythmic swish of the mop head against the tiles, her mind drifted. She wasn't Maya Vance, the grey mouse. She was back in the dust, the heat, the screaming. Viper. We need a line. He's bleeding out. The sand was turning to mud under her knees. The roar of the firefight was deafening. Nurse, Maya snapped back. Mr. Henderson was awake, looking at her with kind, watery eyes. You okay, dear? He asked. You were staring 1,000 miles away. Maya forced a smile. It didn't reach her eyes. I'm fine, Mr. Henderson. Just thinking. Don't let that prick Sterling get to you, the old man wheezed. I saw him trying to intubate that kid yesterday. Shaky hands. He projects. That's what they call it. I should get back to work, Maya said, checking his IV drip. Rest now. She walked out only to collide with a wall of blue scrubs. It was David, one of the few male nurses, and the only person who treated her with mild indifference rather than disdain. Heads up, Maya, David said, looking tense. Multi-vehicle pile-up on I-95. ETA 3 minutes. It's bad. Sterling is running lead. Stay out of his way. I'm assigned to Trauma 1, Maya said. Swap with me, David urged. You don't want to be in there with him when the pressure hits. He'll look for a scapegoat. I can handle it, Maya said, her voice suddenly firm. David looked at her, surprised by the sudden steel in her tone. But before he could speak, the ambulance bay doors flew open. The chaos had arrived. The ER exploded into motion. Paramedics rushed in, shouting vitals over the din of beeping monitors and ripping Velcro. Male 30s, unrestrained driver, blunt force trauma to the chest. BP 80 over 50 tachycardia at 130. Sterling was in the center of the room, shouting orders that were too loud and slightly contradictory. Get him on the monitor. Cut the clothes. I want a chest X-ray stat. Maya moved to the patient's left side. Her movements, usually perceived as slow, were actually incredibly efficient. While the other nurses fumbled with scissors, Maya had the patient's shirt cut away in 2 clean strokes. She slapped the leads onto his chest without looking her eyes, scanning the patient's torso, bruising on the left flank. Tracheal deviation, beginning. Unequal chest rise. Dr. Sterling, Maya said. Her voice wasn't loud, but it cut through the noise. Breath sounds are absent on the left. Trachea is shifting. He has a tension pneumothorax. Sterling was busy trying to find a vein in the patient's collapsed arm. I'll decide the diagnosis, Vance. Get the X-ray in here. There's no time for X-ray, Maya said, her hand hovering over the tray of instruments. He's crashing. You need to decompress the chest. Needle thoracostomy. Now. Are you questioning me? Sterling roared, spinning around a syringe in his hand. I said wait for the X-ray. His BP is stable enough. BP is dropping, Maya said, pointing at the monitor. 70 over 40. He's going into obstructive shock. Shut up! Sterling screamed. Jessica, get her out of my trauma bay. Jessica grabbed Maya's arm. You heard him. Get out. Maya didn't move. She looked at the patient. His face was turning blue. His neck veins were distended like ropes. He had seconds. "Do it," her training screamed. Protocol 4, decompress. But she was a civilian nurse. She was Maya Vance. If she acted, she would lose her license. If she didn't, this man would die. "Doctor, please," Maya said, her voice calm, devoid of the fear Sterling expected. 14-gauge needle. Second intercostal space. Mid-clavicular line. Do it or he codes. Sterling turned purple with rage. "Security, get this lunatic out of here." Suddenly the monitor let out a solid, high-pitched tone. "Flatline." "He's coding," David yelled. "Starting compressions. No." Sterling panicked. "Get the crash cart. Push EP." "Compressions won't work on a tension pneumo," Maya shouted, breaking protocol, breaking character. She ripped her arm away from Jessica. "The heart can't fill because the air is crushing it. You have to pop the lung." Sterling froze. The arrogance drained from his face, replaced by the terrified incompetence of a boy playing God. He stared at the monitor, frozen. Maya looked at the patient. She looked at the 14-gauge angio cath sitting on the tray. She didn't think. She moved. In one fluid motion, Maya grabbed the needle. She didn't shake. Her hand was as steady as stone. She palpated the ribs on the patient's left side, 1, 2, and slammed the needle down. Hiss. The sound was audible even over the chaos. It sounded like a tire deflating. A rush of trapped air escaped the patient's chest cavity. "Rhythm is back," David shouted. "Sinus touch. BP is coming up 90/60. The patient gasped, a ragged, desperate intake of air. He was alive. Maya stepped back, dropping the needle into the sharps container. She smoothed her scrubs. The room was killant. Every doctor, nurse, and tech was staring at her. Sterling looked at the needle in the chest, then at Maya. His face twisted from shock to humiliation. "You," Sterling hissed. "You assaulted a patient." "I saved his life," Maya said flatly. "You performed a surgical procedure without a license and against a direct order from the attending physician." Sterling's voice rose to a shriek. "You are finished, Vance, finished." "Dr. Sterling," David interjected. She was right. He was dead. She brought him back. "I don't care if she turned water into wine," Sterling yelled. "She is a nurse. She stays in her lane. Get out of my ER. Vance, go to the director's office and wait for the police. I'm pressing charges for assault and malpractice." Maya looked at him. For a second, her eyes, usually dull and avoidant, flared with a cold, predatory light. It was a look that had terrified insurgents in Kandahar. Sterling stepped back instinctively, though he didn't know why. "I'll go," Maya said. She turned and walked out of the trauma bay. She didn't run. She didn't cry. She walked with a rhythmic, measured gait. As she reached the hallway, she heard Jessica whispering loudly to an intern. "Did you see that she's a psycho? She could have killed him." Lucky guess that's all it was. Maya went to the locker room. She sat on the bench and stared at her hands. They weren't shaking. They never shook when it mattered. Only when she had to pretend to be normal. She opened her locker. Taped to the inside of the door was a small, crumpled photograph. A team of 6 people in dusty fatigues standing in front of a scorched Humvee. Maya was in the middle, her hair short, an M4 carbine slung across her chest, a med kit on her leg. "I tried," she whispered to the photo. "I tried to be normal." She pulled out her phone. She needed to call her union rep. She needed to prepare for the end of her career. But before she could dial, the hospital walls began to vibrate. It started as a low thrum rattling the coins on the bench. Then it grew louder. Thump, 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 thump. The sound of heavy rotors. Low altitude. Military grade. Maya froze. She knew that sound. It wasn't the standard Medevac chopper. The Medevac had a higher pitch, a lighter engine. This was a beast. A Sikorsky SH-60 Seahawk. She stood up, her heart hammering against her ribs, not from fear, but from a sudden electric shot of adrenaline. Why is a Navy bird landing at a civilian hospital in the middle of Ohio? She walked out of the locker room, drawn toward the ambulance bay windows. Outside, the sky was darkening as the massive gray helicopter descended right onto the hospital's front lawn, ignoring the designated helipad on the roof. It was too heavy for the roof. Traffic on the street had stopped. People were running toward the windows. The wind from the rotors whipped the manicured hedges flat. The landing gear crushed Dr. Sterling's prized rose garden near the entrance. Maya watched as the side door gunner slid the heavy door open before the wheels even touched the grass. 4 figures jumped out. They weren't paramedics. They wore multicam combat pants, tactical vests, and drop-leg holsters. They moved with a violence of action that made the hospital security guards back away with their hands up. Leading them was a man who looked like he was carved out of granite. Commander Jack Breaker Thorne. Maya gasped, her hand flying to her mouth. Jack. She hadn't seen him in 3 years. Not since the ambush in the Arghandab Valley. Not since she walked away from the teams. He was storming toward the ER entrance, his men flanking him. He didn't look like he was there to visit. He looked like he was there to invade. Maya backed away from the window, her back hitting the wall. They found me. The automatic sliding doors of the emergency room entrance didn't just open. They were practically shoved off their tracks. The first man through the door was a giant. He wore a tactical headset, a plate carrier loaded with magazines, and a sidearm strapped to his thigh. He didn't look like a soldier. He looked like a weapon system wrapped in human skin. This was Chief Petty Officer Miller Callsign, Tank. Behind him came 2 more operators, moving in a diamond formation, eyes scanning the waiting room behind ballistic sunglasses. They didn't point their rifles at the civilians that would cause a panic, but they held them at the low, ready fingers, indexed along the receiver, signaling that violence was a mere twitch away. The waiting room went dead silent. A baby stopped crying. A man with a broken arm forgot his pain. Paul, the hospital's bewildered security guard, a retired postman whose toughest day involved chasing teenagers off the parking deck, stepped forward, his hand resting uncertainly on his pepper spray. "Excuse me. You can't bring weapons in here. This is a gun-free zone." Paul squeaked. Miller didn't even slow down. He simply extended a massive hand, placed it gently but firmly on Paul's chest, and moved him aside as if he were a cardboard cutout. "Secure the perimeter," Miller said into his headset. "Alpha Team has the lobby. Bravo, secure the elevators." Then Commander Jack Thorne walked in. If Miller was the hammer, Jack Thorne was the scalpel. He wasn't wearing a helmet. His hair was close-cropped gray at the temples. His face was a map of scars and hard decisions. He wore a standard Navy working uniform, but stripped of the usual patches, save for the trident pinned to his chest. He walked straight to the reception desk. The receptionist, a young woman named Sarah, was trembling so hard her keyboard was rattling. "I need the location of Lieutenant Commander Maya Vance," Thorne said. His voice wasn't a shout. It was a low, gravelly rumble, that carried more authority than a megaphone. Sarah blinked, her mouth opening and closing like a fish. Who? Maya Vance, Thorne repeated, leaning in. Nurse, about 5'5", brown hair, probably hiding in the background. Where is she? Before Sarah could answer, the double doors to the trauma bay swung open. Dr. DeMarcus Sterling stormed out, his face a mask of indignation. He had heard the commotion and naturally assumed someone was disrespecting his hospital. What is the meaning of this? Sterling demanded, marching up to Thorne. He puffed out his chest, trying to use his height to intimidate the SEAL. It was like a poodle barking at a wolf. You landed a helicopter on my rose garden. You are disrupting a medical facility. I am the chief resident, and I demand you leave immediately, before I call the police. Thorne looked at Sterling. He didn't look angry. He looked bored. He looked at Sterling's pristine white coat, his expensive watch, his soft hands. Are you the OIC? Thorne asked. I am Dr. Marcus Sterling, and I don't care about your name. Thorne cut him off. I asked if you are the officer in charge. We have a critical extraction incoming. I need your best trauma assets, and I need Vance. Sterling laughed. It was a high, incredulous sound. Vance. You landed a military assault team to find Vance, the nurse I just fired for incompetence. Thorne's eyes narrowed. The temperature in the room seemed to drop 10 degrees. He took a step toward Sterling. You fired her. She's a liability. Sterling scoffed, emboldened by his own arrogance. She's a mouse. She shakes when she pours coffee. She nearly killed a patient 10 minutes ago with a cowboy stunt. She is a disgrace to the profession. Thorne stared at Sterling for a long, uncomfortable second. Then he turned to Miller. Tank, did you hear that this civilian thinks Viper is a liability? Miller chuckled, a low, terrifying sound. That's funny, boss. Real funny. Thorne turned back to Sterling. Listen to me closely, Doctor. The woman you call a mouse is a decorated Naval Special Warfare combat medic. She served 3 tours with DevGru. She is the only person on this continent qualified to perform the procedure we need. So unless you want to be arrested for obstruction of a federal operation and treason, you will shut your mouth and point me to her. Sterling froze. The words didn't make sense. DevGru combat medic, Maya. That's impossible, Sterling stammered. She cries if I yell at her. She's acting, you idiot, Thorne growled. She's trying to reintegrate, trying to forget the things she's seen, things that would make you wet your pants. Just then the door to the locker room opened. Maya stood there. She had taken off her scrub top, revealing a plain grey t-shirt underneath. Her arms, usually hidden by long sleeves, were visible. They were toned, wiry, and scarred. A long, jagged burn scar ran from her elbow to her wrist, shrapnel from an IED in Syria. She held her purse in one hand. Her posture was different. The slump was gone. Her chin was up. Her eyes were dry. "Hello, Jack," she said. Her voice was steady. Thorne turned. The hardness in his face melted just a fraction. "Maya, you look like shit." "Civvy life doesn't suit me," she replied, walking past a stunned Jessica and a paralyzed Sterling. She stopped in front of Thorne. "Why are you here? I told you I was done." I turned in my trident. "I'm retired." "We don't get to retire, Viper. You know that," Thorne said softly. "It's the senator's son, Lieutenant Caleb Mitchell." Maya's face went pale. Caleb, the pilot. He took a round in the pelvic girdle during a training op gone wrong near the border. High-velocity fragment. It nicked the femoral, but it's lodged against the iliac artery. It's a widowmaker fragment. It's barbed. If we pull it, he bleeds out in 10 seconds. If we leave it, the sepsis kills him in an hour. Maya closed her eyes. She knew the injury. She had written the paper on it. The Vance Protocol for Complex Junctional Hemorrhage. Why bring him here? She asked. Why not Bethesda? Why not Walter Reed? We were in transit. He started crashing over Ohio. We didn't have time. We tracked your cell phone. We knew you were here. Thorne stepped closer, his voice dropping to a plea. The flight surgeon on board is terrified to touch it. He says only you can do the extraction without nicking the artery. Caleb is asking for you, Maya. He's dying. Maya looked at Thorne. Then she looked at the hospital staff, staring at her. She saw David, the nurse, who had defended her, looking at her with awe. She saw Sterling looking at her with fear. She looked down at her hands, the hands that shook when pouring coffee. She made a fist. It was rock solid. Where is he? Maya asked. Medevac Bird is 2 minutes out behind us. We secured the roof, Thorne said. Maya turned to the room. The transition was instant. The grey mouse was dead. The Viper was back. David, she barked. The volume and command in her voice made David jump. Yes, Maya. I need Trauma 1 prepped. Sterile field. I need the vascular tray 2 units of O-negative warm on the rapid infuser. Get the massive transfusion protocol running. And get me a Doppler ultrasound. On it. David ran no questions asked. Maya turned to Jessica. The bully nurse shrank back. Jessica. Maya said, her voice like a whip. Get out of my way. Dr. Sterling said, Jessica stammered. Dr. Sterling, Maya said, turning to the chief resident, is going to stand in the corner and keep his mouth shut. If he speaks, if he touches a patient, if he so much as breathes too loudly, Chief Miller will remove him from the premises. Am I clear? Sterling opened his mouth to protest, but Miller stepped forward, cracking his knuckles. Sterling shut his mouth and nodded. Clear, Sterling whispered. Good, Maya said. She looked at Thorne. Let's go get the kid. The roof of Mercy General was not designed for a heavy military transport helicopter, but the pilot of the incoming Pave Hawk didn't care about structural engineering limits. The massive machine hovered inches above the helipad, its rotors screaming, kicking up gravel and dust. Maya ran onto the roof, flanked by Thorne and Miller. The wind tore at her clothes, but she moved with the practiced crouch of someone who had spent half her life around rotary wing aircraft. The side door opened. A flight medic was performing CPR on a young man strapped to a litter. Let's move. 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 Thorne screamed over the comms. They offloaded the litter. The patient, Lieutenant Caleb Mitchell, was pale as a sheet soaked in blood and sweat. A massive pressure dressing was clamped over his right hip, groin area. As they ran the gurney toward the elevator, Caleb's eyes fluttered open. He saw Maya. Viper! He wheezed, blood bubbling at the corner of his lips. I got you, Cal, Maya said, grabbing his hand. Stay with me. Don't you dare quit on me. Hurts. I know. We're going to fix it. They burst into the ER. The scene was surreal. A dozen Navy SEALs were securing the perimeter of the trauma bay. Nurses and doctors were pressed against the walls, watching in terrified fascination. Maya guided the gurney into Trauma 1. David, hook him up. I want vitals every 30 seconds. Cut the pants. Dr. Sterling was standing in the corner as ordered, but his ego couldn't take it. As Maya began to scrub her hands at the sink, he stepped forward. "This is insanity," Sterling shouted. "You are a nurse. You cannot perform surgery. This is a vascular repair. You need a board-certified surgeon." Maya didn't turn around. She kept scrubbing. "Is there a vascular surgeon in the house?" "Sterling. Well, no, Dr. Evans is on vacation, but then I'm the best you've got," Maya said. She turned water dripping from her elbows. "And for the record, Doctor, I performed more vascular repairs in the back of a Chinook in a sandstorm than you have in your entire sterile air-conditioned career." She snapped on her gloves. "Thorne, I need you on the head. Talk to him. Keep him calm." "Roger that." Thorne moved to the head of the bed. Maya approached the wound. She removed the pressure dressing. The injury was horrific. A jagged piece of metal, part of the helicopter fuselage from the training accident, was embedded deep in the inguinal crease. It was pulsing. "It's pulsing," David whispered, terrified. "It's on the artery." "It's in the artery wall," Maya corrected. "It's acting as a plug. If we pull it straight out, the femoral artery unzips, and he bleeds out in seconds." "So what do we do?" David asked. "The Vance Protocol," Thorne said from the head of the bed. Maya took a deep breath. She reached for a scalpel. "I need a Reboe catheter," she said. "A what?" the hospital pharmacist asked from the doorway. "Resuscitative endovascular balloon occlusion of the aorta," Maya said rapidly. "It's in the trauma supply, closet top shelf. Dusty box. Nobody here knows how to use it. Get it, now." David ran and returned seconds later with the kit. "Sterling," Maya said. "Make yourself useful. Can you insert a guide wire?" Sterling blinked. "Yes." "Scrub in. Now." Sterling looked shocked. You want me to help?" "I need 4 hands," Maya said. "Put your ego aside and help me save this kid, or get out." Sterling hesitated, then ripped off his jacket and ran to the sink. "Okay," Maya said, looking at the wound. "Here's the plan. We go in through the contralateral femoral artery with the Reboe. We inflate the balloon in zone 3 of the aorta. That stops blood flow to the pelvis. That gives me a 3-minute window of dry field to extract the shrapnel and stitch the artery before his legs die from lack of oxygen. 3 minutes. "That's impossible," Sterling said, stepping up to the table. "You can't suture a femoral artery in 3 minutes." "Watch me," Maya said. The room went silent. The only sound was the rhythm of the heart monitor. "Inserting Reboe," Maya announced. She moved with lightning speed, threading the catheter into the patient's left leg, pushing it up into the aorta. "Balloon up. Inflating." She pumped the device. The pulse in the wound stopped. The bleeding halted. "Timer," Maya shouted. 3 minutes, start." David hit the timer on the wall. Maya switched to the right side. The jagged metal was ugly. "Scalpel." She widened the incision. She reached in with forceps. "Careful," Sterling whispered, sweat dripping down his forehead. "It's hooked." "I see it," Maya said. She didn't shake. Her hands were instruments of precision. She rotated the metal shard counterclockwise, then a slight lift. Clink. She pulled the metal free and dropped it into a metal basin. "Artery is torn," Maya said. "Laceration is 2 centimeters. It's jagged." 2 minutes remaining, David called out. "Suture," Maya demanded. 60 proline. She began to stitch. Her hands were a blur. Loop tie cut, loop tie cut. It was like watching a machine. You're going too fast, Sterling said. You'll miss the intima. I never miss, Maya muttered. 1 minute. She was halfway done. The artery looked like a shredded tire, but under her needle it was becoming a tube again. 30 seconds, legs are turning mottled, David warned. Almost there. Maya gritted her teeth. Last stitch. 10 seconds. Maya threw the final knot. Balloon down, deflate. She released the air from the aortic balloon. Blood rushed back into the pelvis. Everyone held their breath. They stared at the repair site. If it leaked, blood would spray the ceiling. 1 second, 2 seconds, 3. The artery pulsed. Thump, 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 thump. It held. Not a drop of blood leaked. Distal pulses, Maya asked, dropping her hands to her sides. David ran his hands to the patient's feet. He felt for a pulse. He smiled wide. Strong pulses in both feet. He's pinking up. A cheer went up in the trauma room. The SEALs, usually stoic, were fist-bumping. Thorne let out a long breath. Maya stepped back, stripping off her bloody gloves. She took a deep breath, and suddenly the adrenaline dumped. Her knees wobbled. Thorne was there, instantly catching her by the elbow. I got you, Viper. Maya looked up at Sterling. The arrogant doctor was staring at the suture line. He looked at it like it was a piece of art. That? Sterling swallowed hard. That was the most incredible piece of surgery I have ever seen. And I studied at Hopkins. He looked at Maya. For the first time, he didn't see a mouse. He saw a titan. Who are you? Sterling whispered. Maya straightened her back. She looked him dead in the eye. I'm the nurse you asked to clean up the vomit, she said. The extraction was as rapid and violent as the arrival. Once Lieutenant Mitchell was stable, Commander Thorne barked a single order into his headset. The SEALs who had secured the perimeter collapsed back toward the trauma bay like a well-oiled machine. They loaded the gurney with the recovering patient, and within 90 seconds they were gone. The roar of the Pave Hawk faded into the night sky, leaving behind a shattered rose garden, a traumatized staff, and an eerie silence in the ER. Maya stood by the sink in Trauma 1, staring at her reflection in the stainless steel paper towel dispenser. She looked exhausted. The adrenaline crash was hitting her hard, making her limbs feel like lead. She wasn't the Viper right now. She was just Maya, a civilian nurse who had broken every rule in the book. Vance. It was Dr. Sterling. He was leaning against the doorframe, looking uncharacteristically disheveled. His tie was loosened, and there was a smear of blood on the cuff of his pristine white coat. Doctor, Maya said, not turning around. How? Sterling asked. It wasn't an accusation. It was genuine, baffled curiosity. The speed, the precision. You didn't even hesitate on the REBOA placement. Most trauma surgeons go their whole careers without doing one of those live. Maya finally turned. She dried her hands slowly. You learn fast when the nearest operating room is a 6-hour flight away, and the mortars are walking in toward your position. Sterling nodded slowly, processing this. The mouse he had tormented was a lioness who had just let him pet her cubs. He felt a strange mixture of professional jealousy and profound shame. Listen, Vance. Sterling started, his voice awkward. About what I said before. About firing you. And the coffee. I was under stress. Save it, Marcus, Maya said wearily, using his first name for the first time. It felt strange in her mouth. I don't care about your apology. I just want to know if I still have a job tomorrow. Before Sterling could answer, the doors to the ER burst open again. This time, it wasn't Seals. It was worse. It was the hospital director, Evelyn Reed, flanked by the hospital's head of legal and a frantic-looking PR manager. Reed was a woman whose smile was terrifying because it never reached her cold, calculating eyes. Dr. Sterling, Nurse Vance, my office. Immediately, Reed commanded. Her voice was ice. As they walked through the lobby toward the administration wing, Maya realized the scope of what had happened. The waiting room was packed, but not with patients. Every person had their phone out. They were filming her. That's her, someone whispered. The commando nurse. I heard she killed a terrorist in the parking lot. The rumors were already spiraling out of control. In Reed's plush office overlooking the city lights, the mood was funereal. Reed threw a tablet onto the mahogany desk. It was playing a video. It was shaky footage shot on a phone from behind a potted plant in the lobby. It showed Commander Thorne getting in Sterling's face. It showed Thorne announcing Maya's background. She served 3 tours with DevGru. She is the Viper. The video already had 1.5 million views. The hashtag #MercyGeneralHero was trending #1 nationally. Do you have any idea the liability nightmare you've created? Reed hissed, pacing behind her desk. Armed military invasion, unauthorized surgical procedures performed by nursing staff. The Joint Commission is going to crucify us. Our insurance carrier is having an aneurysm right now. She saved a senator's son, Evelyn, Sterling said, surprising Maya by coming to her defense. If she hadn't acted, he would have died on our floor. Think of the PR nightmare that would have been. Reed stopped pacing. She looked at Sterling, then at Maya. The gears in her mind shifted from damage control to opportunity capitalization. A senator's son, Reed murmured. A slow, predatory smile spread across her face. Yes. Senator Mitchell is very influential on the Health Appropriations Committee. She turned to Maya. The ice in her voice melted into synthetic warmth. Maya, darling, Reed said, stepping closer. You're a hero. A bona fide American hero hiding right here in our little hospital. This is wonderful. Maya felt sick. 5 minutes ago, I was a liability. That was before I knew we could spin this, Reed said dismissively. The morning shows are already calling. Good Morning America wants you. CNN is parked outside. We need to get you in front of a camera. We'll tailor a statement. You acted on instinct, utilized your past training in an extreme emergency, and Mercy General is proud to employ veterans. It's gold. No, Maya said firmly. Reed blinked. Excuse me. I'm not doing interviews. I'm not a prop for your fundraising campaign, Maya said. Her voice was quiet again, but the steel was underneath it. I came here to be a nurse, to be normal. I don't want to be the Viper anymore. You don't have a choice, Vance. Reed snapped, the warmth vanishing instantly. You performed medicine without a license. That is a felony. I can protect you from the state board if you play ball with the PR team. If you don't, I'll feed you to the wolves. I'll have your license revoked by noon tomorrow and wrap this whole incident around your neck as a rogue employee act. Maya looked at Reed. She had faced down Taliban warlords who had more honor than this woman in a Versace suit. Do what you have to do, Evelyn, Maya said. She turned and walked out of the office. She needed air. She needed to escape. But when she got to the staff exit, She saw the sea of news vans and satellite trucks outside. The glass doors of the hospital felt less like protection and more like the walls of an aquarium. Everyone was watching the fish. 72 hours later, Maya sat at a long, polished oak table in a conference room at the state capitol. The air conditioning was set too low, a common tactic to make the accused uncomfortable. She was suspended without pay. The media storm had been intense. Half the country saw her as a badass patriot. The other half saw her as a dangerous vigilante who thought she was above the law. Across from her sat the 5 members of the State Board of Nursing Disciplinary Panel. They were stern-faced men and women who had spent decades deep in the weeds of bureaucracy and protocol. To them, a checklist was more holy than a Bible. At the head of the table was Chairperson Patricia Davies, a woman with severe glasses and a tight bun, who looked at Maya like she was a particularly stubborn stain on a uniform. "Ms. Vance," Davies began adjusting her microphone, "we are here to determine if your actions on the night of November the 14th constituted a gross violation of your scope of practice as a registered nurse in the state of Ohio. The charges are severe: practicing medicine without a license, performing invasive surgical procedures, and insubordination." Maya sat straight, her hands folded on the table. She wore her best pantsuit, which felt restrictive compared to scrubs or fatigues. "I understand the charges, ma'am. Let the record show," Davies droned, "that the patient survived. However, outcome is not our primary concern here. Process and legality are. We will first hear from witnesses." The door opened and Jessica walked in. She looked nervous, smoothing her skirt repeatedly. She avoided making eye contact with Maya. "Ms. Albright," Davies said, "tell us what you saw." Jessica took a deep breath. "Maya, Ms. Vance was always unstable. Shaky hands, quiet. When the soldiers came in, she just snapped. She started shouting orders at doctors. She physically shoved me out of the way. It was terrifying. It felt like she was having a PTSD episode and just started cutting on a patient." "Did she appear competent during the procedure?" one of the board members asked. "I don't know, I was too scared to look," Jessica lied. "It just looked like butchery. Dr. Sterling was trying to stop her and those soldiers threatened him." Maya felt a flash of anger but tamped it down. Control. Jessica was dismissed. Next was Dr. Sterling. Sterling walked in, looking uncomfortable in a tailored suit. He sat in the witness chair and glanced at Maya. There was no malice in his eyes anymore, just a complicated mix of resentment and respect. "Dr. Sterling," Davies said, "did you authorize Nurse Vance to perform a re-BOA placement and arterial vascular repair?" "No, I did not," Sterling said clearly. A murmur went through the panel. "Did you attempt to stop her?" "Yes, initially." "And why did you stop trying?" Davies asked. Sterling paused. He looked at his hands, then at the board. "Because if I had stopped her, Lieutenant Mitchell would be dead right now. And because, frankly, she was doing a better job than I could have." The room went dead silent. A chief resident admitting a nurse was better. It was unheard of. Davies looked sour. "Dr. Sterling, are you saying her violation of protocol was justified?" "I'm saying that in a combat situation, which that ER effectively was the rules change," Sterling said, finding his spine. "She had the training. I didn't. She saved a life. You can strip her license if you want to follow the letter of the law, but you'd be punishing a hero for being a hero." "Thank you, Doctor. You may step down," Davies said coldly. She turned her gaze to Maya. "Ms. Vance, your background in the military is impressive. But you are a civilian nurse now, You cannot simply decide when the rules apply to you. You put the hospital at immense risk. You undermined the physicians. This is cowboy medicine, and we cannot tolerate it. Maya leaned forward toward the microphone. With all due respect, Chairperson Davies, when a 19-year-old kid is bleeding out from a junctional hemorrhage, the virus of bureaucracy is more deadly than the bullet. I didn't undermine the physician. I assisted him by doing what he couldn't. I didn't put the hospital at risk. I prevented a death on their premises. If that makes me a cowboy, then buy me a hat. Davies's face turned red. Your insolence will not help your case. The evidence is clear. I am recommending the immediate and permanent revocation of your nursing license. The other board members nodded in agreement. It was over. Maya closed her eyes. She had survived war, only to be taken down by a committee in a conference room. Knock, knock. The heavy oak doors at the back of the room didn't just open. They were opened with authority. 2 Navy Shore patrolmen in dress blues stepped inside, holding the doors open. Through them walked a man wearing a uniform dripping with gold braid. Admiral Charles Vance, the Judge Advocate General of the United States Navy. And Maya realized with a jolt her estranged uncle. The entire board stood up reflexively. Admiral Vance didn't look at them. He walked straight to the table, carrying a leather briefcase. Admiral Vance, Chairperson. Davies stammered. This is a closed state hearing. You have no jurisdiction here. On the contrary, Ms. Davies, the Admiral said, his voice booming in the small room. He placed the briefcase on the table and clicked the latches open. I'm here because this hearing involves classified naval warfare methodology and personnel. He pulled out a thick binder stamped Top Secret No Fawn in red ink. He slammed it onto the table in front of Davies. What is this? Davies asked, looking terrified to touch it. That all, the Admiral said, pointing a manicured finger at Maya, is the service record of Senior Chief Maya Vance, and the document you are looking at is the Vance Protocol for Far-Forward Resuscitation of Non-Compressible Hemorrhage. He leaned over the table, his presence dominating the room. You are accusing her of practicing cowboy medicine without a license. I am here to inform you that she wrote the licensing exam for that specific procedure. The technique she used to save Lieutenant Mitchell isn't rogue. It is the current standard of care for naval special warfare medics operating in austere environments. It's classified because we don't want our enemies knowing how good we are at keeping our people alive. The Admiral looked around the table, daring anyone to challenge him. Lieutenant Mitchell was on active duty. The moment his team entered that hospital, that ER became a forward operating base under military jurisdiction. Senior Chief Vance was the ranking medical officer on site for that specific injury. She wasn't acting as a civilian nurse. She was reactivated by the on-scene commander Jack Thorne under Article 9 of the Uniform Code of Military Justice due to extreme exigency. He turned to Maya, his stern expression softening just enough to show family pride. You're not retired until we say you're retired, Viper. He turned back to Davies, whose face was now pale grey. So you have 2 choices, Chairperson. You can continue this farce, revoke her license, and I will have this entire board subpoenaed to testify before a Senate Armed Services Committee hearing on why the state of Ohio is interfering with national security assets. The Admiral paused for effect. Or you can recognize that extreme circumstances require extreme competence. Dismiss these charges with prejudice, and let this woman go back to doing what she was born to do, saving lives. The silence in the room was absolute. You could hear a pin drop. Davies looked at the classified binder, then at the Admiral, then at Maya. The bureaucratic wall had just been hit by a cruise missile. The sound of the gavel hitting the wood block was the sweetest sound Maya had heard in months. In light of new evidence regarding jurisdiction and emergency protocols, Chairperson Davies said, her voice tight and clipped, "The board moves to dismiss all charges against registered nurse Maya Vance. The suspension is lifted immediately. This hearing is adjourned." The room exhaled. Admiral Vance closed the classified binder with a snap that echoed like a gunshot. He didn't smile at the board members. He simply nodded once, a gesture of dismissal that made them feel like cadets who had failed inspection. Maya stood up her legs, feeling shaky for the first time that day. She turned to her uncle. "Thank you, sir," she said, slipping back into military formality. "Don't thank me, Maya," the Admiral said, his eyes softening. "Thank Jack. He called me the minute he got back to base. He told me you were getting railroaded. And for the record, your mother would have been proud of what you did in that ER." Maya felt a lump in her throat. She swallowed it down. "I just did the job." "You always do," he said. He picked up his briefcase. "Don't be a stranger, Viper. The family misses you. And maybe, stop hiding. You're terrible at it." With that, the Admiral strode out his shore patrol escort, flanking him, leaving the state board members staring at their paperwork in stunned silence. The next morning, Mercy General Hospital felt different. As Maya walked through the sliding glass doors, the air didn't feel heavy with judgment anymore. It felt electric. She wasn't wearing the baggy, oversized scrubs she used to hide in. She wore a fitted navy blue, set her hair tied back in a practical no-nonsense bun. She walked with her head up her stride, long and purposeful. The receptionist, Sarah, looked up. "Good morning, Maya. Coffee is fresh." "Thanks, Sarah." Maya smiled, a real smile. As she walked toward the nurses' station, the whispers started, but they had changed. "That's her. The one the Admiral defended. I heard she can intubate a patient blindfolded." Jessica was at the station reorganizing charts. When she saw Maya approaching, she froze. She looked like a deer caught in headlights. The bully who had made Maya's life a living hell was gone, replaced by a terrified woman who knew she had poked a sleeping dragon. "Maya," Jessica said, her voice trembling. I put your schedule on the board. You're in Trauma 1 today." Maya stopped. She looked at Jessica. She could have reported her. She could have humiliated her the way Jessica had done to her for months. "Thank you, Jessica," Maya said simply. "And tighten your ponytail. It's dipping into the sterile field when you lean over." Jessica blinked, surprised by the lack of venom. Yes, of course. Right away." Maya walked past her. She didn't need revenge. The fear in Jessica's eyes was victory enough. She entered the break room. Dr. Sterling was there, staring out the window at the repaired rose garden. He turned when he heard the door. For a moment, neither of them spoke. The history between them, the coffee, the insults, the surgery, the hearing hung in the air. "I expected you to quit," Sterling said. "Go back to the Navy, or go to a hospital that didn't try to ruin you." "I'm not running anymore, Marcus," Maya said, pouring herself a cup of coffee. She didn't shake. "And besides, this place is a mess. You need someone who knows how to handle a crisis." Sterling snorted. It was almost a laugh. "That's an understatement. The board of directors is still hyperventilating. Evelyn Reed is trying to figure out how to put your face on a billboard without you suing her." "She can try," Maya said, taking a sip. "But I have a condition for staying." Sterling raised an eyebrow. "Oh, and what is that?" "My parking spot. A raise." "I want to run the trauma training program," Maya said. I watched your residents during the Code Blue last week. They're slow, they panic, they rely on technology when they should be relying on clinical skills. I want to teach them the Vance Protocol. I want to teach them how to think when the world is falling apart. Sterling looked at her. He thought about the way she had moved during the surgery on Lieutenant Mitchell. The efficiency, the calm. It was exactly what his department lacked. He extended his hand. Done, Sterling said. Lead trauma coordinator. You answer only to me. And frankly, I'll probably just listen to you anyway. Maya took his hand. His grip was firm. One more thing. Sterling added a glint of humor in his eyes. Next time a helicopter lands on my roses, warn me. No promises. Maya smirked. Later that day, the ER was quiet. The chaos of the morning rush had subsided. Maya stood in Trauma 1, the room where everything had changed. She pulled out her phone. She had a text from Jack Thorne. Thorne Kyleb is out of ICU. Walking with a cane, but walking. He says, thanks, Viper. Drinks are on the team next time you're in Virginia. Maya typed back, tell him to walk it off. And I drink whiskey. Neat. She put the phone away and looked at her reflection in the glass cabinet. She saw the scars on her arms. She saw the lines on her face. But for the first time since coming home, she didn't see a broken soldier or a terrified nurse. She saw Maya Vance. Nurse Vance, David called out from the hallway. Incoming MVC, 2 victims unstable. Maya turned. The adrenaline sparked familiar and welcome. I'm ready, she said. She grabbed her stethoscope and walked out to meet the ambulance, not as a ghost, but as the hero she had always been. And that is the incredible story of Maya Vance, the woman they tried to break, only to find out she was made of steel. It's a powerful reminder that you should never judge someone by their silence. You never know what battles they've fought or what storms they've weathered. Maya didn't just save a life that day. She saved herself by embracing who she really was. If this story had you on the edge of your seat, please hit that like button. It really helps the channel grow. Share this video with a friend who needs a reminder that quiet people are often the strongest. And if you want more stories about heroes hiding in plain sight, subscribe and ring the notification bell so you never miss an upload. Thanks for watching, and I'll see you in the next story and Horde.